learning environment. Jeroen has published widely on cognitive load theory for CID and lifelong learning in the professions. He holds several academic awards for his publication and his international contribution. His books about training complex cognitive skill and 10 steps to complex learning had a major impact on the field of instructional design, has been translated in several languages. Jeroen has published more than 400 articles, book chapters, and he has already had more than 40 PhD students who have completed their thesis under his profession. So we are very happy to have you today, Jeroen. Please, whenever you are ready, you can start the session.
Thank you very much for the nice introduction, Astrid. Welcome, everybody, to this webinar. I'm very happy to give this presentation on four-component instructional design, which is online, which is quite normal in these days of COVID-19, because all our teaching is online at the moment. And in my presentation, I will also focus on the application of four-component instructional design to online education. I will start sharing my screen. Okay, maybe before we start, a few rules. First, if you are in the audience, please mute your microphone so that we do not disturb the presentation. If you have any questions during my presentation, please use the chat, and we will pause several times in order to answer the questions. So don't pose any questions by using the microphone. Please put them in the chat box. And there will also be some polls, questions and assignments during this webinar. Please actively participate in that. With regard to today's schedule, we scheduled a 2-hour meeting. I will start with some opening questions, just to make clear what the main focus of this presentation will be. And then I'll give an introduction to the four-component instructional design theory. Then Astrid will provide an example course that has been designed according to 4CID, and you will be working on a number of assignments. At the end of the webinar, there will be questions and answer, a discussion on the applications of the model, and a closing poll with some closing questions to check whether you have learned anything from this webinar. Okay, let's start with some questions. And I think these questions are really at the heart of instructional design. And if everything works fine, okay, there is our first question. I'll read out the question. The most important component in good education, and then we have 4 options, is the feedback that we provide to our students on their task performance, is the information that we present to our students in lectures or in other ways, or it are the tasks that are performed by the students in which they apply the information that we provided to them. And finally, this is the most popular one, we need all 3 components that are necessary for long-term learning to occur. Well, I'm very glad that 90% of the participants voted for option D, because one of the main messages of my presentation today is that in good education, we do not only need to present information, but above all, we need to ask our students to apply this information in learning tasks, and we need to provide feedback on them. Personally, I only call something education when it contains all 3 elements: presentation, practice, and feedback. Let's go to the second question. And this is a question comparing online education and face-to-face education. And again, I came up with 4 options. Good online education is always inferior to face-to-face education, is based on exactly the same learning principles as face-to-face education, although it differs in the way that information, learning tasks, and feedback are delivered to students, is totally different from face-to-face education, so we need other learning principles, or it offers exactly the same learning opportunities as face-to-face education. And here the responses are a bit more varied than for the previous question, but I think B is probably the answer that is most easy to defend. How people learn is defined by their cognitive architecture, by how cognitive processes and learning processes function, and that's exactly the same for face-to-face education or online education. So I think, and the 4CID model also assumes that the basic design of online education and face-to-face education is identical. Although there is a difference in the way that information, tasks, and feedback is delivered to the learners. So the difference is in the delivery and the delivery methods, but not in the basic learning principles. D is also an interesting one. I see that some people voted for D, offers exactly the same learning opportunities as face-to-face education. I don't think so, because in the medical field, when we think about learning to do physical examination, it's very difficult to do it online. Of course, we could use simulation, but we cannot do the real thing. So especially for psychomotor tasks, sometimes face-to-face options are the only options. And the best we can do is use high fidelity simulation as a proxy. Okay, well, I think we make a good start. And the answers to these 2 questions are quite basic to the rest of my presentation. First, good education always involves learning tasks, information, and feedback. And second, the basic learning principles are identical for face-to-face education and online. Let's go to the CID model. 4CID meaning 4-component instructional design. And if you are interested in learning more about the model, it has been described in 2 books. The book Training Complex Cognitive Skills, which is mainly a psychological description of the background of the model, and the book 10 Steps to Complex Learning, that is now in its 3rd edition. And this book provides a more applied view on the model, explaining how to develop education that is based on the 4 components. The main assumption of the 4-component instructional design model is that good education is built from 4 interrelated components. And the components are called learning tasks. That's where knowledge is applied, and the learning tasks provide a backbone of the educational program. Then we have 2 types of information that is provided to students. Supportive information helps students to perform the non-routine, the problem-solving and reasoning aspects of the learning tasks, while the procedural information helps them to perform the routine aspects of learning tasks, the aspects of learning tasks that are always the same. And finally, 4th component is called part-task practice. And part-task practice might be necessary to provide additional practice for the routine aspects of learning tasks. Well, what I'd like to do in this opening presentation is have a closer look at each of the 4 components. starting with the learning tasks. And the idea is that students can only develop competencies by working on learning tasks. And in this schematic representation, I describe these learning tasks as circles. And when we develop a course, or when we develop an educational program, or even a whole curriculum, we can simply describe it as a series of learning tasks on which students are working. And this word learning tasks is a very generic term. It can be problems that students work on, like in problem-based learning. It can be projects they work on, like in project-based learning. It can be tasks, assignment, cases, scenarios. These are all examples of learning tasks. There are two important requirements to learning tasks according to the 4C ID model. First, ideally they are based on authentic real-life tasks. In the medical domain, often professional tasks, tasks that a nurse or a doctor or a physiotherapist or a dentist has to do in practice. And when tasks are real-life tasks, they are almost without exception integrative tasks that make an appeal on both knowledge, skills, and attitudes. And making an appeal on both knowledge, skills, and attitudes is thought to be important because that helps students to develop competencies. Then the question, should we provide these learning tasks offline or online, face-to-face or on the computer? Well, I already indicated in the 4C ID model, it's both possible, and there is not a fundamental difference. In an offline situation, we can apply role play or have project groups or PBL groups or professional tasks that are performed at the workplace, or use scenarios in a high fidelity simulation lab or a skills lab. The online equivalents are the online project group or an online PBL group, or scenarios that students work on in a computer-based simulation or gaming environment. So in terms of learning, the environments are fully comparable. They allow students to work on the learning tasks, often in a simulated setting. But the difference is how they are delivered. Are they delivered face-to-face or in an online environment? And today you will also be put in smaller groups to work on a task, being an example of online working on learning tasks. In the 4C ID model, we then pose a number of requirements to the learning tasks. And the requirements relate to variability, simple to complex sequencing, and decreasing support and guidance. Well, let's have a closer look at these requirements to the learning task that we provide to our students, to our learners. To start with variation. And when we look at the schematic representation of the educational program, this is indicated by these small triangles in the learning tasks that are always on a different position. Variation of learning tasks means that the learning tasks in our course differ from each other on all dimensions on which professional, authentic tasks in the real world also differ from each other. And only when learning tasks in a course or a curriculum are different from each other, our learners can develop abstract, general cognitive schemas, cognitive representations that allow them to work on new, unfamiliar tasks. I put this picture of butterflies here, and everybody will say, oh, these are butterflies, which is actually an interesting thing, because when we look at the butterflies, they are very different from each other. Some are red, some are green, some are yellow, some are big, some are small. Nevertheless, we learned that it are all butterflies by being confronted with many different examples. When we were children, our parents would probably point out, this is a nice butterfly, that is a nice butterfly. And maybe as a child, we spotted a beetle and then said, that's the butterfly. And then we were corrected, no, that's not a butterfly. And thanks to this variation in what we see, we develop general knowledge that allows us to recognize new situations as fitting the schema or not. So it's possible that you visit the Netherlands and you see a butterfly, and you might point to it and say, that is a nice butterfly. I have never seen a butterfly like that. And that's precisely what we want to reach in education. The ability to recognize something that you have never seen before, but nevertheless know how to deal with it, know how to name it in this case. For learning tasks, it's the same thing. Each patient is unique, but in order to be able to treat or diagnose a new patient, it is necessary that you have a lot of experience with many different patients. That allows you to develop the knowledge that is necessary to deal with new patients. So summarizing, the learning tasks in an educational program must be representative for the tasks that you encounter in the real world. Variability or variation is a key requirement to the learning tasks. A second requirement that is especially important for educational programs of longer duration is levels of complexity. What we typically do is sequence the tasks in an educational program from relatively simple tasks in the beginning to more and more complex tasks later in the course, later in the program. So although we start out with authentic real-life tasks right away, these are the simplest tasks that a professional could encounter in the real world. And then we slowly increase complexity until complexity is at the level of, well, at the end of a program, a just graduated student. Is this a new idea? No, it's not. 100 years ago, this was already described as a spiral curriculum. So it's a spiral approach. Yeah, we work from simple tasks to more complex tasks to more complex tasks. And when we look at the schematic representation of the educational program, you see that at each level of complexity, that's the dotted boxes around the set of learning tasks, at each level of complexity, we need variation amongst learning tasks to help students develop general knowledge they need for transfer of learning. Then there is one more requirement to the learning tasks, and that relates to the guidance, the help, support, and guidance that we provide to students. What we typically do is, let me see if I can. What we typically do is when students go from simple tasks to more complex tasks, we first provide them with a lot of support and guidance. That's indicated by the filling of the circle. Then we provide them less support and guidance, and even less until they are able to perform a task without any support and guidance. And when they show that they are able to perform a task independently, without help from a teacher or without help from the instructional materials, we go to a higher level of complexity. But when we go to a higher level of complexity, Again, we provide a lot of support and guidance to students, which decreases again until we can go to a higher level of complexity again. So this is an important principle when we develop educational programs of longer duration. We not only increase the complexity of the tasks from simple to complex, but on each level of complexity, we also decrease the support and the guidance that we provide to students. For example, we could first give them examples or first give them worksheets that help them to perform the task. And after practicing on the examples and practicing with the worksheets, they will be able to do it independently. And when they show that they're able to do it independently, we can continue to a higher level of complexity. Again, this is not a new idea. In many learning theories, we find comparable principles. Some of you might have heard of the zone of proximal development, a term that was coined by Lev Vygotsky. And Vygotsky asked himself the question, when do students learn most? And his answer was, students learn most when they perform tasks that are actually a bit too difficult for them. So they are really challenged. But thanks to the fact that they are supported by their teacher or supported by their peer learners, they are able to perform the task. And that's precisely what we see in this educational blueprint, in this schematic representation. We provide the level of support and guidance that students need. Not too much support, not too little support, but precisely the support they need to complete a relatively difficult and challenging task with the support given. And that's where learning is optimized. Okay, so this is all about the first component, the learning tasks. And what we see here is that the learning tasks are ordered from simple tasks to more complex tasks, that on each level of complexity we need variation amongst tasks, and also on each level of complexity we first provide a lot of support and guidance. For example, we provide example materials, we provide process worksheets, but the support and guidance is decreasing until students are able to perform the tasks independently. And this decreasing of support and guidance is also called scaffolding, because when you build a house, the house is going up and the scaffold is going down. So that's the same principle here. Okay, then we have three more components. And the first one is supportive information. When students work on learning tasks, it's obvious that they often need theoretical information, supportive information that enables them to work on the tasks. They need to know a lot of things in order to work on the tasks. And the supportive information is all the information that we provide to students because it helps them with the problem solving and reasoning aspects of the tasks. It's models of the domain. Yeah, when you are training a medical doctor, you need to know about diseases, about the working of medication and things like that. That's domain models. It's knowledge about how to approach problems in the domain, systematic approaches to problem solving. When I'm dealing with a patient, I must first do my diagnosis, do my physical examinations, do the intake interview, ask for laboratory results, make a treatment plan, evaluate the effects of the plan. So there is a systematic approach. That's also part of the supportive information. It's something you should know in order to be able to perform the tasks. And cognitive feedback, feedback that helps students to critically reflect on their own performance and to compare their own performance with the performance of experts or other students is also part of the supportive information. When we look at the schematic representation, this supportive information is indicated by this L-shaped figure, showing that we can present the supportive information before students start to work on the learning tasks, or we can make it available to students while they are working on the learning tasks. In the 4CID model, it's both possible. In project-based education, for example, it's quite common that students first visit lectures, study materials before they start to work on the project. So, let me see. So we first present the supportive information and only then they start to work on the project. But in problem-based learning, some of you might be familiar with problem-based learning, students first study a problem and they define their learning issues, and then they study the supportive information in what's often called the study landscape. And they go to a new problem, and again, they study the supportive information that allows them to solve the problem. In 4CID, it's both possible, but the general idea is that starting with problems works best for students with low prior knowledge, let's say first-year students, while starting with the supportive information might work well for students who already have some prior knowledge, because for them it's easier to understand the supportive information. They can link the supportive information to the knowledge they already possess. When we look at the offline or online presentation of supportive information, it should be obvious that the supportive information in traditional face-to-face education is typically given by lectures, by reading books, by studying encyclopedia, using real things like a skeleton, physical models. That's all face-to-face. In online education, we typically make use of video clips or presentations like I'm giving right now, because I'm also providing you with supportive information. Hypermedia, social media, computer animation, micro worlds are all online ways to present supportive information. Then we have a third component, and that is called procedural information. While the supportive information relates to the problem solving and reasoning aspects of a task, the procedural information relates to the routine aspects of a task, the things that are always the same. I mean, when you are training doctors, you can use cases or patients, and each patient will be unique. Each patient will be different from the other patients. So there is a lot of variability. And we need this variability in order to develop transferable skills. But at the same time, there might be routine aspects that are always the same. When I do physical examination, auscultation, or measuring the blood pressure, or doing CPR, it's really a routine aspect. And for these routine aspects, we present procedural information. It's how-to information specifying how to perform the routine. And in contrast to supportive information, that's best presented in a book or in a lecture, the procedural information is best presented just in time, while students are performing the task. It's often a teacher looking over the shoulder of the student and pointing out what to do and in which order things must be done. Or providing corrective feedback, saying, no, 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 now you're making a mistake, you should do it like this. Corrective feedback is also best provided just in time, precisely at the moment that students need it. And in the schematic representation, we also see that the procedural information is linked to the learning tasks. So it is presented to students when they need it while performing on the task. Well, in the traditional face-to-face environment, procedural information is typically provided by the instructor, who is acting as an assistant looking over your shoulder, but also user manuals, checklists, job aids, quick reference guides are the ways we provide information to students just in time while they are doing it. In an online environment, it can be online instruction or online job aids or help systems or mobile technology, or nowadays augmented reality, in which you are working on a task, and while you are working on a task, reality is augmented by directions that you can see on your Google Classes, for example. So the presentation of procedural information is fundamentally different from the presentation of supportive information. And then there is one more component that also relates to the routine aspects of tasks. There might be routine aspects of tasks that need to become automated, that need to be practiced up to a level where you can perform the routine aspects without giving it any thought. And often this pertains to the critical safety, critical aspects of a task. And what we do then is pick out this routine aspect from a whole task and practice it in isolation, like we do on a part task trainer for surgeons, practicing dexterity skills. But also CPR or reanimation is a nice example of a part task that is trained apart from the whole tasks. What is important here when we look at the representation is that it is done in a good cognitive context, meaning that part tasks are only trained after the part has been introduced in the context of a whole meaningful task, so that students understand how practicing this part of the task might help them to become better in performing the whole task. And what, of course, is important for part task practice is repetitive practice. Practicing it over and over and over again until you can do it without conscious control. Giving intravenous injections, doing CPR, doing auscultation, recognizing particular abnormalities on an X-ray. These are all examples of routine aspects of tasks that can be trained as part task training. Well, this is actually the schematic representation of a whole educational program based on the 4 components. For the part task practice, again, it can be done offline, paper and pencil, or a skills laboratory, or part task trainer in a simulation lab, or the real task environment. And we also have online equivalents, computer-based training, games for basic skills training, online part task trainers that give the online equivalent. For me, designing an educational program is a bit like designing or putting together a skeleton. This is the skeleton of a whale, I think, or a dinosaur. And what you see is we have this backbone. And when I design an educational program, This backbone consists of the learning tasks, and the learning tasks are sequenced from simple to more and more complex. On each level of complexity, there is this decrease of support and guidance, and there is the variability. And the other three components, the supportive information, the procedural information, and the part task practice, are connected to this backbone where they best support students' work on the learning tasks. So it all starts with the learning tasks, and the other components are connected to the learning tasks. That's what we do when we design courses according to the 4 components. Well, Astrid will now take over from me and present an example course. But maybe before we do that, it's good to see if there are any important questions in the chat box.
Thank you so much, Jeroen. I think the chat box is empty yet. There is no questions.
Okay.
So
and I'm very clear. Nobody has any questions. So then if the chat box is still clear, we can continue to discussing an example of a real course that has been designed on the basis of 4CID. Then it's up to you, Astrid.
Okay. Thank you. So, ladies and gentlemen, we have listened to a lecture about what is 4CID, and Jeroen has already explained about the 4 components one by one and the basic principles of the 4 components. Now, I would like to present an example of a course blueprint that is developed based on the 4CID approach. And this is a chronic pain assessment skills training. As a disclaimer, this course blueprint was modified from a thesis for anesthesiology and intensive care study. It was developed based on the context of the undergraduate curriculum of Faculty of Medicine, Universitas Indonesia, and it was simplified and adjusted for the educational purpose of this webinar. So this is a very short example to help you understand the 4CID design. Yeah. Perhaps you have watched this film, House MD. Dr. House is one of my favorite characters. He's a very bright doctor, very good in diagnostic skills, but he has chronic pain in his legs. And if you are familiar with the character, he is a miserable person. His chronic pain affects a lot of his emotional life. He can be very sarcastic, and also he does not have smooth social relation with a lot of people. And it really shows, it really reflects our chronic pain patients, because the chronic pain apparently not only a biological problem, but also a very serious psychosocial problem. An article in Anesthesiology Journal called Time to Flip the Pain Curriculum said that if we would like to emphasize the education of pain from the cellular stage of subcellular, it seems that it does not prepare our trainees enough to take care of our chronic pain patient. And we have to make other approach. And this is based on this principle, we develop a course using 2 mnemonics. The first mnemonic is PQRST mnemonics, and it focuses on the biological aspects. I think some of you are familiar with this mnemonics because it's frequently used in the education, and also in the hospital accreditation in Indonesia. PQRST mnemonic is also recommended as a structure for pain assessment in the hospital. And we add the ACT UP mnemonic to emphasize the psychosocial aspect in the assessment. So if you can see, for example, A stands for activity. It means that in the chronic pain assessment, you have to ask how the pain influence the activity of the people. Or in P, people, you can also ask how the pain affect the relationship of the patient with other people. So it means that in this course, we would like to integrate the biological aspect and psychosocial aspect in the assessment of the chronic pain as a whole learning task. And we would like to help students perform comprehensive chronic pain assessment. This is very similar to the 4CID principle that the learning task should be a whole task learning. So we develop our course based on 4CID, and we have two task classes. The first task classes is in a simulated setting, and we have some supporting information here. And we also have 3 learning tasks. Each learning task is tailored with procedural information. And here we don't have part task practice. But as you can see, in the end of the task class 1, we also provide the cognitive feedback. We will go into more detail. Yeah. So in the task class 1, learners are confronted with situations in which they need to construct steps and practice of pain assessment in simulated setting. And as a supportive information, we provide a lecture on theory of pain assessment, including pain physiology, and a video of a role play of chronic pain assessment. And this can be made asynchronous online learning by providing the link of the video for the students. The students can access the video beforehand. This is the example of a slide of a lecture of pain physiology. So here we differentiate the nociceptive pain and neuropathic pain. And by understanding this type of pain, students will be understood how to pick up questions when they ask the quality of the pain. This is an example of supporting information, a video of role play of chronic pain assessment. I will play the video very shortly, and don't worry if you don't listen the voice clearly, because this is just an example.
Sampai pada saat nyeri yang Bapak tadi angkat berat, Bapak tadi sedang duduk lama, apa yang Bapak, apakah nyerinya kayak tusuk-tusuk, nyeri kumpul, atau gimana Bapak?
Rasanya, kayak orang bilang, kemeng kali ya, bilangnya kayak pegel, bukan yang kayak ditusuk visual apa sih, enggak gitu juga sih, ya kita kemeng aja.
This is in Indonesia.
Oh, kalau pas itu kadang ya kayaknya.
So in this video you can provide some information here as a subtitle, so your students can understand what are the purpose of the questions.
Bagusnya sih ke paham. Hanya itu.
Jadi jalan dari tubuh sampai ke
rasanya ke.
Misal kalau pada saat nyeri yang Bapak.
Okay. So this, sorry. That's the example of the video as a supporting information. After watching the video, you can ask the learner to come into class, a synchronous online session, and then you can discuss together to reflect the demonstration, and then they can discuss the principles of chronic pain assessment. And as procedural information, you can provide a handout of what is PQRST act mnemonic, because in this phase perhaps they have not really understand or really remember the mnemonic. The facilitator is available to answer questions. In the learning task 1.2, you can ask the learner to practice pain assessment, and you can ask for volunteer. It will be nice to have a synchronous online learning session, and you can provide various scenarios. I would like to present example of scenarios here. So if you remember the story of the butterfly that Jeroen has presented, you can make the variation of scenario for chronic pain assessment by vary the clinical problems, vary the patient demography, or you can also vary the psychosocial problems. So you can have exactly 2 patients with same clinical problems, same back pain, but one is a nurse who has to frequently lift up or move patient from the bed, so he has back pain, and another one is a cleaning service staff that has to bow frequently when he does the cleaning. So by doing this, you can have variation on your scenario. Yeah. In the learning task 1.3, you can ask your learner to practice pain assessment in pairs, and this can be made asynchronous online learning. And later on, the learners can send a video recording to you. And by doing this, you will decrease the level of support because facilitator is not available to answer the question. So if you remember the picture of the bicycle with three wheels, and this is the way you decrease the support. Now we come to the task class 2. In the task class 2, we will make some changes. First, we will increase the complexity by making it a real setting and real patients and integrate the physical examination. And you also can provide a supporting information related to this task class that is a lecture about physical examination and chronic pain. And also we will have 2 learning tasks in this task class, and we will provide part task practice. Now we will go to see it into more detail. This is the task class 2. So in the task class 2, the complexity is increased by asking the students to learn in a real setting with real patients, and also by integrate the physical examination. So by doing this, you can see the spiral. In the learning task 2.1, learner can be asked to practice pain assessment in different encounters with real patients. And of course, because of the pandemics, we need to think about online learning ideas. For example, you can ask the students to interview with family member or friend with chronic pain, or you can also make a synchronized session interviewing real stable patient at hospital via video. So you as a facilitator, as an attending physician, can stand beside the patient, and then you can ask your students to ask questions to the patients. And of course, whatever your choice, you have to consider ethical issue, you have to ask permission, informed consent from the patients to be a part of the education session, and you also have to ask perhaps the permission from the hospital. Okay. So this is an example of video recording sent by a learner performing pain assessment with a patient with chronic headache. So the patient is her friend, and this is a asynchronized session.
Ya, selamat siang dokter. Saya Tina. Ini beberapa hari terakhir saya merasakan sakit kepala yang sangat mengganggu dan berbeda dari biasanya karena sampai nyeri di bagian leher. Dan itu cukup mengganggu aktivitas saya, gitu dok.
Itu nyerinya sejak kapan, Bu Tina?
Sudah sekitar seminggu terakhir. Dan nyerinya itu tidak kontinu, tapi hari ini datang, besok pagi datang lagi, seperti itu. Dia datang, berhenti, begitu.
Okay, so then we can continue to learning task 2.2. Back to synchronized online learning discussion. Some students can present their video recording, and then you can have a discussion about what they have done, and you can provide feedback. It is very good if you can tailor this session with a part task practice, that is the skills training on the physical examination of area with pain. So for example, if you have a case with back pain, you can provide the students, you can ask the students to do a straight leg test or Plastic test, and you can explain that this is to examine the involvement of ischiadicus nerves. But of course, in the pandemic, perhaps you have to postpone this one. And finally, as supportive information, don't forget to give cognitive feedback on the learning tasks that you have asked the students to do. So, the key message of this example is the 4CID shift the perspective of learning from lecture to learning task. Usually when we do online education, we will focus on how to give us lecture, how to give our students lecture, and then followed by questions and answer session. But we will move beyond lecture. We will move to the learning task to help students to achieve their competence. And the task should be a whole task. And in this example, our whole task is the integration of biological and psychosocial aspect of chronic pain assessment. We don't only focus on the biological and then later on have a communication skills training, for example, only on the psychosocial, but we combine both in one session. And as you can see from this example, most activities can be organized online. Learning tasks, supportive information, procedural information, you can access it online. You have to decide which one will be provided synchronized and which one is asynchronous. And apparently you can have a lot of asynchronous session, so you can help the students to save the internet quota if they have problem with that. And the practice, yeah, unfortunately, if it cannot be organized online, this should be conducted later. But as you can see from this example, the task practice is a part of the whole learning task. So as long as the students grasp the whole task and they know how to place the task practice, it will help them to achieve their competence as much as possible during the pandemic. Thank you. Now, this is a short example. And after this, we really would like you to feel the 4CID design. So in this session, it is not only lecture, we will have a small workshop. So you can join us to work on some learning tasks. I will show you our assignments.
Astrid, maybe before we go to the learning tasks, we should have a look at questions in the chat box. Oh, yeah. Thanks for your wonderful presentation of the application of the model. Very clear.
Okay, thank you, Jeroen. Let me see if we have some questions. Oh, okay.
Here I see, is the learning task different from the learning objective?
Yeah.
Maybe I can answer that one.
Yes, please. Yes, please.
Learning tasks and learning objectives are interrelated, of course, because the learning task is what students do and the objectives is what they are required to reach after the course. What is quite typical for component instructional design is that working on learning tasks helps students to attain more objectives. This is also called integrated objectives. And that has to do with this idea of competence development. Competencies typically encompass a lot of objectives. And by using meaningful whole learning tasks, you help students to work towards multiple objectives at the same time. So it's a good question because objectives and learning tasks are closely interrelated to each other. But what is typical for 4CID is that learning tasks always correspond with more objectives. Both objectives that relate to attitudes, objectives that relate to skills, objectives that relate to knowledge. It tries to integrate different types of objectives.
Okay. Thank you, Jeroen. So in Bahasa Indonesia, learning task is actually tugas, penugasan. Okay, thank you. Shall we continue to the assignment? I will share my assignment, my screen. Yeah. So, ladies and gentlemen, we are now here. We have did the first three parts, and then we are now in the learning task. So we would like you to try also our learning task. So this webinar is also designed based on the principle of 4CID. We have provided 2 learning tasks with decreasing support and guidance. So try to apply and enjoy the online learning session. The first one will be based on these 2 task classes that I have presented before. Dr. Titin, can you please share the poll so our participants can try to answer some questions? So this is the first poll. What is supporting information provided for task class 1 of pain assessment course? This is nice. The number keeps changing. Okay. Yeah, we are still waiting for some folders.
Dr. Astrid, if you want me to stop the poll, just let me know.
Okay. Okay, I think we can stop now. Yeah, thank you, Dr. Titin. Jeroen, would you like to discuss a bit about the first question?
Yes. What strikes me here is that A and B are equally popular, while A and B actually relate to the difference between procedural information and supportive information. And the right answer is B. It's the link of the video on the lecture, because the video makes very clear that this is about a general way to deal with a situation that is different from patient to patient. So you can show 10 videos and each video will be different from each other. There is variation there. And that is critical for the supportive information. The supportive information helps students to deal with the variation in cases, the variation in patients. A is also information that's provided to students, but in the 4CID model, this is what we call the procedural information. It's the information relating to the routine aspects that are always the same. And this mnemonic is a good example of a mnemonic that can be used in the same way in each situation. So A relates to procedural information, but B relates to supportive information. And it's quite common that in the beginning, it's not that easy to make this distinction between what is procedural, what is supportive. For me, the rule of thumb is always, is it information that I can repeatedly use in the same way from case to case, or is it information that is more general and that will vary from case to case? And video examples are almost without exception supportive information, because they can be used to show the variation that is there out in the profession or in the real world.
Thank you, Jeroen. Now we are going to the second poll. Oh, this what is, can we go to the, okay, thank you. How did the variability in the task class 1 was ensured? If you see the variability, please remember the butterflies with different colors and shapes. Okay. Yes, I think we can stop now. Yeah, I think for this second questions, most participants answer B by providing various cases of scenario, 66%, and that's the correct answer. Yeah, so by make different clinical cases, different type of patients, different demography, we can vary the scenario. Okay, we can go to the third questions. Why is the facilitator not available in Learning Task 1.3? Okay, I think we can stop now. Yeah. Jeroen, would you like to give some comments on these questions?
Yes, this is about reducing the level of support. So option D is indeed the correct option. What is important to understand is that there are many different ways to reduce support and guidance. What is quite popular in medical education is this description of first observing an expert performing the task, then performing the task under direct supervision, then performing the task under indirect supervision, and finally performing the task independently, which is a very nice example of how we could organize decreasing support and guidance or scaffolding. But in 4CID, we also describe other ways to decrease support and guidance. For example, starting out with process worksheets and then slowly fading out these process worksheets until students are able to perform the tasks independently. Or first studying a lot of example materials or video materials that is identical to observation at the workplace in a sense, and then slowly working towards independently working on the tasks. So the correct option is D, which was also the most popular one. And 4CID provides a lot of different ways of scaffolding. So depending on the situation, you can search for the best options.
Okay, thank you. Do we still have some questions, Dr. Titin? Oh, yeah, one more. Okay, can we go to the next question? Yeah. Okay, so this is the last question for assignment 1. How is the level of complexity increasing in task class 2? Okay, I think we can stop the vote. Jeroen, can you help discuss this question as well?
Yes, actually, like we have many different ways of scaffolding in 4CID, we also have many different ways of increasing complexity. But one very common way to increase complexity is to start with paper-based patients, like we do in PBL. There is a problem on paper saying, well, suppose you are a doctor and the patient is going into the room with these and these symptoms, what would you do? That's relatively simple because it's not a real patient, it's only on paper. You can discuss the different options, you can come up with your learning issues. So that is one way to simplify tasks. And when we then increase complexity, we could, for example, work from paper-based to virtual patients on the computer, bringing in more complexity, bringing in the option to ask for more information about the patient, and so on. And then we can continue to simulate human patients, bringing in even more complexity. And finally, at the end of a curriculum, bringing in the real patients. So working from paper-based simulated patients towards real patients, option D, is a really powerful way to increase complexity. It's not the only way. We can also look at the particular clinical patterns of patients, of course. Patients that have multi-morbidity are typically more difficult, more complex to treat than patients with one simple disease. But in this context, it's option D, which was also the most popular one.
Okay, thank you so much, Jeroen. So this is the end of the assignment 1, your first learning task. And now we are going.
And the audience did a very good job, I think. Most of the questions were correctly answered.
Yes, we are very proud of you. So I
Yes.
hope you enjoyed the first learning task, and we are going to take you to the second one. Yeah. So this is the second assignment. You have to develop the task class 3 of the chronic pain assessment. So I have already provided you with task class 1 and task class 2, and now you are free to create the third one. And the host is going to divide you into small groups of 6 to 8 persons using the Zoom breakout rooms. If you are not familiar with this feature, this is also a very nice opportunity to try this, because later on you can try it with your students and it's very nice, very exciting. So when you are in the small groups of the breakout rooms, be aware that there will be no facilitator that will help you, because we are going to decrease our support. That is the way we do it. So you have to choose your own chair and a scribe. Scribe in Indonesian is notulen, ya. Jadi cari notulen, ya. As you saw our example that I gave you, please continue our course. Please develop task class 3 of the chronic pain assessment course. And before you go to the breakout room, download the worksheet from the Zoom chat room. Dr. Nadia, can you please share now the worksheet? So before we go to the breakout room, everybody can try to download the worksheet.
It is shared already, Dr. Astrid.
Oh, thank you. And then you have 15 minutes for discussion and filling in the worksheet. So the worksheet serves as a procedural information for you. And then after 15 minutes, the host is going to put you back into a plenary session, and then we will randomly pick few groups to present your worksheet. When you enter the Zoom breakout, in the top of your screen, you will see a group number. So please remember your group number, because later on we will call you. And then the scribe of the group should present the worksheet. Please use Zoom share screen feature. And if you are not familiar with Zoom, this is a very brief way. So worksheet for CID website is in the chat room. You can download it from here. And later on in the plenary session, you can see the share screen here. You just click the share screen and then you can click the Excel file. This is the worksheet. So you will have an Excel file like this. You don't have to start from scratch. And then you can just erase the italic things and then fill it with your own course. Yeah. Okay. Shall we now go to the breakout rooms?
Okay, we are preparing for the breakout room now.
Okay. See you soon and enjoy your learning task.
See you.
Okay, turns out that we have some participants who couldn't join the breakout rooms for some reasons. Here we have around 7 participants. So do you want to probably share your assignment here, Dr. Astrid, so that the participants in the main room can also do the task?
Yeah.
Okay. Or probably I can assign them to, because it's a bit tricky to, we have some participants who are disconnected from the Zoom and going back again in the waiting room while we have already assigned people to the breakout room. So it will be quite, yeah. So to those participants who are still in the main room, the task is in front of you. Okay. So Dr. Astrid, would you please let me know, I've already set my time in 15 minutes. Now we have another 6 minutes.
Okay.
Okay.
I think it's good to broadcast that we have 6 minutes left.
Okay, I will. I didn't have time to rename the groups. So I think later you can just call out the names. Nadia will help you with calling out the names of the group members. Or you can just call breakout room 1, 2, 3, 4, 5, 6, and etc.
Okay.
Okay, message is broadcasted. It is fun, Jeroen. Really fun.
It's this is really different from face-to-face, where you could
Yes,
see
it
the
is,
groups
yes.
going around the room and see the groups working. So
yeah. The host can actually do that. I don't know whether you can the co-host actually can do that as well. We can join. Yeah, you can, right? You can join. Yeah.
So you are able to visit the different
yes.
breakout.
Yes.
Okay. Now, Zoom is also new for me, so I'm also learning today.
Yeah. Every single webinar, we learn new things.
Yeah.
So thank you for the opportunity, giving us a new challenge to do the breakout rooms with the group and providing all the learning tasks. It's fabulous. Thank you. And also to you, Dr. Astrid, thank you.
You're welcome. I think we will extend our time a bit because we're already late.
Okay.
Yeah.
We will inform the participants later.
Yeah. I mean
later.
later.
Yeah.
For
the breakout room, 6 more minutes, but I can close the rooms anytime.
Okay. I mean later on the whole webinar session will be over 3 o'clock, I think.
Yeah, I think it's okay.
Yeah.
15 or 30 minutes extension will be fine. 15 minutes will be better.
Okay. So that we can let our participants learn more.
Okay, to the participants who are now joining in the main room, We are now actually in the group discussion session in the breakout rooms. So to those of you who were disconnected and going back again with us now, you're in the main room and we are all waiting for the groups to finish the task. In front of you is the task, if you want to see. Dr. Astrid, would you like to explain the task to the participants in the main room? We still have 5 minutes for the ones in the breakout rooms.
Yeah, so what you need to do is basically to create the task class tree. So increase the complexity, continue the task classes that I have presented before. And then you can think about what will be the task class tree, what will be the supporting information you provide to the students, what will be the learning tasks. And then you don't have to go for always 3 learning tasks. You can have 1 or 2 learning tasks, for example, and then you can add the procedural information that is linked to every learning task. And if you need, you can also add the part task practice. Yeah.
Okay.
I'm curious to know the presentation.
Me too. It will also be nice to ask about people's experience in the breakout room.
Oh, that's true. Mm-hmm.
But shortly, of course, given the time.
Okay.
We have 122 participants coming in. Yeah, that's quite a good number.
How many breakout rooms do we have?
23.
23 breakout rooms.
Yeah.
Okay.
Three more minutes.
I think so far we have 3 questions, Jeroen. What we will address
Yeah,
it.
we will. Maybe we should first do the presentations, and then there is a question and answer session. Then we can deal with the questions.
Okay. Mm-hmm.
Okay, 2 more minutes. One minute. I'm counting down. Okay, so I will close all rooms now so that people can have time to go back to the main room. Okay.
Okay, good. Thank you.
So they're given 15 seconds to leave their breakout rooms.
Yeah. I'll stop share my screen because after
Yes.
this we are going to ask the
Yeah.
participant to share the screen.
Yeah. Okay. So now people is coming back. Yay. Yeah, Dr. Astrid, I think we're ready for the next session.
Okay, thank you, Dr. Titin. So I hope everybody is already in the main session, and I hope you enjoyed your breakout room session. Now we would like to ask one or two groups to present their work. And because this is April, shall we call the group number 4? Does anybody, do we have a record on group number 4?
Or maybe any other group who wants to present their findings.
That's a good idea.
Don't forget to unmute your microphone if you want to present to the group.
Yes, or you can put your you can put your name of the group in the chat room if you want to present. And then you will, oh, that's nice. Thank you. Welcome, Dr. Gusti.
Okay. Thank you.
Yeah, thank you.
I come from Bali, Udayana.
Mm-hmm.
I try to make this learning task 3 with my group, but I only have 3 persons in my group, and the others cannot read the Excel. So I try for the learning task 3. So we asked to do the procedural examination due to the pain, and then for the procedural information, we do the video procedural. I think that's all for my groups. Thank you.
Thank you very much, Dr. Gusti. So this is live from Bali.
Yeah.
So would you like to share a bit your experience in the breakout room? Did you experience some challenges?
First, we have 4 persons in my room, but after that we only have 3. But I only talk with only one person, Dr. Nova. Sorry, I can't remember very clearly. And then we discuss about the task 3, and then the result is we try to make like in the Excels.
Okay.
I think one problem that some of the groups encountered is that to fill out the worksheet, you actually need a computer. It's very difficult to do it when you are participating with your phone. And that's a good lesson that we learned, that we should probably instruct participants beforehand that if they want to actively contribute to the assignment, they cannot use their phone, but they would probably need a computer. Yeah.
Yes, thank you.
Okay.
Dr. Kusti, can you maybe explain why you think that the learning task you provided is more complex, more difficult than the ones that were in task class 1 and 2? Because that's one of the main ideas of increasing complexity. What makes your task more complex than the learning tasks in task class 1 and 2?
For me, the question?
Yes?
Yes, because as you explained before, from the task we must increase like a scaffolding. So when I see from the task 1 and 2, so in the task 3 we must increase the complexity, so the student can make by their own, such as like with procedural.
Yeah. Okay. Very good.
Do you have any further remarks, Jeroen?
No, not at the moment. No.
Okay.
Maybe there is another group who wants to present their worksheet.
Is there any other group who would like to present the worksheet?
We are.
Oh, okay. Please introduce yourself, Pak Francis.
Yes.
Santo. We have a pharmacist here.
Yeah, I'm Francis from Surabaya. I don't know we are in which group. And we discussed with the colleagues in our group that we asked the learner to have a more difficult situation with we add the problem with the comorbid disease as a task to be more complicated. And as supporting information, the lecturer will provide a lecture on about pain and other chronic disease as a comorbid. And also, it should be a pain and another chronic disease as a comorbid. And a learning task, we divide into 2 kind of tasks. The first one is learner is asked to practice chronic pain assessment to real patient with comorbid disease, and also learner is asked to give a comment to other groups' experiences. Because when the previous stage is only reflects on their own experience, and giving comments to others groups' experience will give facilitators could evaluate more precise how far the understanding of students. I think that is our discussion with Dr. forget the name. It's not a group in our groups. Thank you.
Okay. Thank you.
Dr. Sandra.
Oh, Dr. Sandra. Yes. Sorry, Doctor.
Okay, it's okay.
Very quick and.
Okay, Pak Frans was with Dr. Sandra. Yeah. Thank you so much. Can you share a bit about your experience working in the breakout rooms?
Yeah, we work very quickly, and only 2 of us are discussing and very efficient, I think. Talking about the plan and with a refer back to the previous presentation given to us in the webinar. And yeah, we work very efficiently.
Okay, thank you. Jeroen, would you like to give some remarks?
Yes, I think this group did an excellent job. Bringing in the comorbidity is a good way to increase complexity in this task class compared to task class 1 and 2. That is also clearly reflected in the presentation of the supporting information. For the two learning tasks, well, task 3.1 is what we typically call a conventional task. So the learner is asked to practice the chronic pain assessment, and in this case with the real patient, which fits the level of complexity of this task class, and it's even a patient with comorbidities. Learning task 3.2 is what we would probably call a case study. So they study how another learner dealt with the patient and is giving comments and feedback on this other group. So it's more learning by analyzing a case, which is also an important type of learning task, especially when students are confronted with a new situation, and this situation is new because it's for the first time they're dealing with comorbidity, and then analyzing a case, analyzing the weak and the strong points is a very powerful way of learning. So I think this group has been indeed very effective and efficient.
Okay, thank you. And Jeroen, in this group, they provide a handout of chronic disease as a procedural information. Could you please perhaps elaborate how to distinguish this handout with the lecture about comorbidity? How can we distinguish that? So which one, how can we make a handout to be a procedural information, not similar as the lecture?
Yeah, of course, handout is a bit a confusing term because you can give many different types of handouts. But if it's a handout for procedural information, the handout will typically have the character of a checklist. So it's a number of points that always need to be checked when dealing with patients with comorbidity. The checklist is the typical example of the handout for procedural information. When I give background information that may be consulted, for example, the diagram of the 4CID model that you distributed, it does not really fit the definition of procedural information. That would be more supportive information because it's not checking point by point if you follow the routine aspects of a procedure, but it's given background information reminding people of what the 4 components are.
Okay, thank you so much.
Yeah. So the word handout is a bit confusing because it can be used in many different ways. If it's procedural information, it will typically be a checklist or a quick reference guide, something like that.
Okay, thank you. Pak Frans or Dr. Sandra, do you have a final remark before we move on?
No, for me.
Okay. Thank you so much for the 2 groups who have presented their work, and I believe that all of you have also have various type of words, various idea. Now we would like to move to the next session, and this is a question and answer sessions. Okay, we have some questions here. The first one is from Dr. Swasta. Dr. Swasta would like to have more example of part-task practice that can be done by online model, so by distance learning, and how many steps that should be arranged. So yeah, we have the example of physical examination, and unfortunately it could not be done online, but perhaps we can have some ideas. Jeroen, would you like to take this question, please?
Yes, part-task practice can take many different forms, and depending on the part task that you are training, sometimes it can be done very well online. Sometimes it's not possible to do it online. You mentioned physical examination or doing intravenous injections or things like that. It's really difficult to do it online because it requires physical contact with a patient or with a simulated patient or with a peer student. But part-task practice can also relate to more cognitive processes. I mean, a very simple example from primary school is students doing part-task practice on the multiplication tables. 3 times 4 is 12, 4 times 4 is 16, and so forth. And that can be done very easily online. Also doing particular calculations in the field of pharmacy might require repetitive practice that can be easily done online. Or in a field like radiology, learning to identify abnormalities on an X-ray requires a lot of practice. And that's just a matter of presenting hundreds of X-rays to practice the identification of abnormalities. That is also something that can be done easily online. So it really depends on the task, what the options are to do it online. And unfortunately, for some part tasks, it cannot be done online because they really require physical contact with another person.
Okay, thank you, Jeroen. So for example, in our chronic pain assessment course, would it be helpful to have radiology reading skills training related to the how to read a radiography for lumbar, for example?
Yeah, for example.
Practice, and then we can do it online.
Yeah.
Okay. Okay, thank you. And I hope that
same for reading electrocardiograms, for example. That's also a good example of something that can be practiced as a part task and that can be done online.
Okay, yeah. So I hope this also answered the questions from Dr. Wasana. Dr. Wasana asked about he would like to have more explanation about part task practice. So basically, part task practice is practicing the routine aspect of the whole learning task. So what we often fall into the pitfall is that we only teach part task practice independently and does not connect it with the whole task. So it will be difficult for the students to later on find where is the place of this certain procedure or certain skills in the whole thing. So by developing the course in 4CID design, it will help us as a teacher and later on help the students to be able to understand the place of this routine certain procedure in the whole task. So like for example, when Jeroen said about the example of other part task practice in other case, like putting, administer the IV line, we can administer the IV line as a part task practice, while the whole task practice, for example, is how to manage a patient with dehydration. And when we manage patient with dehydration, we need to put an IV line. And the IV line administering is the part task practice. And then by doing that, students will understand the importance of the skills for the whole learning task. Yeah. And there is another questions, and this is from Dr. Adisti. Dr. Adisti asks about time allocation. This is very interesting. How about the time allocation for each task class and learning tasks? Could it be different, and how to determine the suitable time? And how to confirm that the students are ready to move to the next task class, or we did not need to?
Oh, these are very good questions.
Yeah.
For the first question, there really is not an answer, because it depends on the domain in which you are teaching. And for some learning tasks that are based on authentic professional tasks, we may be dealing with tasks that can be conducted in 5 minutes or so, but there might also be tasks that require much more time. So the answer is, it depends on the nature of the professional tasks you start from. And when we are teaching students to do intake interviews with patients, a learning task may take 10 or 15 minutes, because that's what it typically takes to do an intake interview with a patient. But when we are teaching students in surgery to do a particular surgical operation that takes 1 hour, the learning tasks will also at least take 1 hour. So it really depends on the duration of the professional tasks, how long it will take to perform the learning tasks, and there is a lot of variation there. With regard to the second question, how to confirm that students are ready to move to a next task class or to move to a higher level of complexity, it touches upon assessment. And we did not really discuss assessment of students in this presentation. But what we often do in education based on the 4 components is indeed use the learning tasks that students perform without support and guidance as test tasks. So these tasks that students must perform independently can be assessed, for example, using a scoring rubric, using other assessment instruments, and then we can conclude whether a student is able to perform a task up to the standards independently. If so, the students may continue to a higher level of complexity. But if a student is not yet ready to perform the task independently, we may provide some additional tasks to practice until the student is ready to continue to a higher level of complexity. So the 4CID model allows for the development of flexible training programs in which some students need more tasks to reach the final objectives of a course or a program, and other students require less tasks to reach the final objectives of the program. And especially in these flexible educational programs, it is important that we assess students, especially on the task they perform without support and guidance, to make decisions on continuing to a higher level of complexity or not.
Okay, thank you, Jeroen.
Answer to the question, Dr. Adisti. Or are there additional questions?
Dr. Adisti, would you like to add some additional question? Okay, then I think we can move to the next question. The next question is from Dr. Fundi from Universitas Erlangga. The question is how to transfer the task into credit. So I assume that what Dr. Fundi mean by credit as SKS, ya, satuan kredit. Would you like to share the experience and mastery, how to transfer the task into the credit in the curriculum?
Some of the participants might also have visited the webinar of Kees van der Vleuten on programmatic assessment. And programmatic assessment is a kind of assessment that very nicely fits a 4CID approach, because we can collect information on all the learning tasks that students work on, and collect the information on how well they are doing on those learning tasks in some kind of portfolio. And then we can make summative decisions on passing or failing for a course on all the information that we collected in the portfolio. So I'm not sure if we should call this credits, but a programmatic assessment approach very nicely fits the 4C ID model, because we can collect information on the quality of task performance over all the learning tasks, collect this information in some kind of portfolio, and then have a close look at the portfolio to make decisions whether a student is performing up to the standards or not, and decide on passing or failing a course.
Okay. Or perhaps we can also see it the other way, because usually in the curriculum we have already determined how many hours for certain courses, and then we can think about, or we can plan in advance if a learning task, or how many hours a learning task will take the time of the students, and it includes the synchronized and asynchronous session, or the meeting if it is in-person meeting, and also the independent learning. And then by calculating the amount of estimated hours they need to put into the learning task, then we can later transfer the learning task into the credit associated with a certain major.
Yeah. Is that also the approach you took for the pain assessment course, Astrid?
The pain assessment course was developed as a short course, unfortunately. I know that actually 4C ID design is very good for the long-term course, but in a curriculum, but here in the pain assessment course, we also first define the length of the course first, and it was actually a one-day course. And then we divide the one-day course into several hours, and then each 1.5 hour was defined as one session. And then after determining the time, then I put the learning task into the time allocated. So when we have already defined the time frame, then it will be easier for us to determine the learning task that is suitable for the time frame. And also related to this, the way to increase the complexity of the class is also by doing more learning tasks or doing more complex learning tasks in the same time allocated. Because by doing that, we will encourage our learners to improve their competence, and also in a part task learning, for example, to improve their skill to be more automated in a certain allocated time. Well, I hope I make myself clear.
Yeah. And was there also a formal assessment of the students in your pain assessment course?
Yeah, in the end of the pain assessment course, there was a simulated assessment with simulated patients, and because it was a standardized assessment, we make a similar case for everybody, and then we record the assessment, and then later on there are raters who rate the course using validated instruments.
Yeah. And what we could do in the course of a longer duration is have this kind of assessment not one time, but have it on each level of complexity. And so we collect information during the course on each level of complexity, and at the end of the course we can then make decisions on all the collected assessment information. So that's what we typically do in educational programs that have been developed on the basis of 4C ID.
Yeah, and additionally, of course, what we need to put in our mind is the final competence that we would like to achieve for the students. So like what Professor Merrienboer has said, that the learning task, its learning task will be record for the portfolio for the students. And it's time when they are able to increase the complexity, they are able to widen their knowledge, it will finally end up into the competence that we would like to achieve.
Yep.
We have some more questions. I think we need to address it. The next question, I think, is from Dr. Titin. She asked, whenever we develop a module with several learning outcomes, does it mean that we can actually plan the learning tasks, supporting information, procedural information, and part task practice for its learning outcome? Or in other words, employ the 4CID framework? Yeah.
I think the answer is yes. What makes this always a bit complex is what are learning outcomes. And when we design a course on the basis of 4CID, we call the learning outcomes performance objectives. So it are descriptions of what learners must be able to do at the end of the course. We describe desired performance at the end of the course or at the end of the program. And when we have the performance objectives, we can start to develop the learning tasks that help students to reach the objectives. And then for the learning tasks, students must learn things. And these are typically called the learning objectives. What they must learn to be able to perform the tasks, and the tasks help them to reach the final performance objectives. So the answer is yes, but in 4CID, we make a distinction between performance objectives, that is what students are able to do at the end of the course, and learning objectives, that is what students must learn in order to be able to perform the learning tasks.
Okay. Yeah, thank you. And the next question is from Dr. Wasana.
On the entrustable professional activities. Well, I think 4CID and EPAs share a lot of characteristics. The main difference is that 4CID has been developed to design undergraduate programs, formal education, while EPAs have been mainly developed in the context of workplace learning. But we see a lot of commonalities. The first one, stressing the importance of whole meaningful tasks. We can call them entrustable professional activities. In 4CID, we call them whole tasks. The importance of decreasing support and guidance. In the EPA framework, it's typically described as first observing, then practicing under direct supervision, then practicing under indirect supervision, then working independently, and finally teaching the tasks. In 4CID, we have similar ways to decrease support and guidance. Of course, there are also differences. 4CID describes the importance of supportive information, procedural information, and part task practice in this process of learning. And this is less visible in an EPA framework, where the focus is on performing professional tasks at the workplace. But overall, there are a lot of commonalities, and I've also been involved in several projects that combine the EPA framework and the 4CID framework, and I think they can really complement each other.
Okay, thank you. Yeah, I would also add something to Dr. Titin's question. I'm sorry, I'm back to that question because it actually reminds me in the structure of the curriculum in the specialization curriculum of anesthesiology in Faculty of Medicine, Universitas Indonesia. I studied there and I realized that it's actually very close to 4CID design. So in general, in Faculty of Medicine, Universitas Indonesia, for the specialization, there are 3 levels of residence and that we have read. yellow and green, and it actually shows the level of independence of the residents. And if we relate that into the 4C ID design, usually in the first level, in the red level, it is like task classes. So they usually will still work on the whole task learning, because, for example, in anesthesia, actually our whole task learning is to give anesthesia to the patient. But it's very simple, because in the red level, we will work with patients with normal patients who need anesthesia, or patient with just mild comorbidity. But when we go to the next level, the yellow level, then the comorbidity will increase. And actually we are moving to the task class 2. And when we move to the green level, not only the comorbidity will increase, but also the level of supervision will decrease. So it is actually very similar for the 4C ID design. And related to Dr. Titin's level, so we can see the 4C ID design. We can use the 4C ID design not only develop a certain course or module, but we can also use the principles to develop the curriculum. Because when we say spiral and integrated curriculum, 4C ID design really serve the purpose. Yeah.
No.
Would you like to add something, Jeroen?
No, I think we are approaching the end of this this session. So maybe we should end this question and answer part, and to close the session, pose some remaining questions to the audience. And we have 2 more poll questions that I would like to pose.
Okay, the place is yours.
See. And the facilitator, please come up with the final poll questions. Okay, so we discussed the 4C ID model, and the 4 components in the model are okay, well, that's 90% for learning tasks, supportive information, procedural information, and part task practice, which is a clear sign that we learned something today. Learning tasks are the backbone of an educational program based on 4C ID, which really makes 4C ID different from many other models, or as Astrid called it, the 4C ID model helps us to go from lectures to learning tasks. It all starts with the learning tasks, and the other components are connected to this backbone of learning tasks. So I'll go to the final question. When you use 4C ID to design online education, it is important to make your lectures available online. It's impossible to deal with large groups of students. You first specify the learning tasks and only then the information that might help students to perform those tasks. Or you first specify the to be learned information and only then connect the learning tasks that help students to apply this information. Okay, so the preferred answer, I think, is C. And this is what makes 4CID different from the way many of us are used to work. As teachers, we are very used to start from presenting. This is what we present to our students, and if there is time left, we give them an assignment or an exercise to practice the things we presented. And the main goal of 4CID is to switch your mind, to switch your perspective, and first ask yourself, what is it that I want my students to be able to do after my course? And then define the learning tasks that will help them to learn doing it. And only then we ask ourselves, and what should I present to my students to help them perform the tasks? So I hope that this central idea has come across during this webinar. I thank everybody for participating. It was also a learning experience for me because I'm not used to using Zoom. Zoom was new for me, so I learned a lot from it, and I hope that you, as an audience, also learned a lot from this webinar. Thanks for your attention. And also thanks to Astrid, of course, for collaborating with me on this course, and thanks to the facilitators who did an excellent job facilitating this webinar. Thank you.
Thank you, Professor Jeroen van Merrienboer, for a very nice session about 4CID. We learned a lot today, and as Professor van Merrienboer also said that we learned a lot from the Zoom. I also learned a lot from this session. I hope all of you also enjoy our sessions, and I hope this session will be beneficial to improve the education in your own institution. Thank you for the host, especially for all the technical support. Thank you, Dr. Titin, Dr. Nadia, and the team. It has been a pleasure to work with all of you. This is a quite complicated thing because this is our first experience, but I hope this will also encourage all of our colleagues across Indonesia to explore different method of learning using different approaches and technology, and it will improve the education. So I would like to close the session. Dr. Titin, would you like to say a final closing statement?
Thank you very much to Prof. Jeroen and also Dr. Astrid for a very insightful and very clear information during the webinar on 4CID. And we
Dr. Titin, we're losing your phone.
Sorry, yeah. Okay, so thank you very much for Dr. Jeroen and Dr. Astrid for very good, I think it's great webinar. Very clear information on 4CID from the Medical Education Center, IMERI, Faculty of Medicine, Universitas Indonesia. We would like to thank you. And to the participants who would like to pose further questions, you can send the questions to our email, and all the recordings as well as the PDF file for presentations of the resource person can be accessed to the link that we have shared in the chat room. And we would like to also share further informations on the further webinar. So next week, okay, so this is the informations that I have shared about the if you have further informations and how you can access the recordings. And for next week webinar, we invite you again to join with us to discuss with the renowned resource person on the adaptation of community-based medical and health professions education during COVID-19 pandemic. So we are collaborating with the Gadjah Mada University as well as the network towards Unity for Health for this the next week webinar. So please visit the link on the registrations. Thank you very much. And thank you very much again to all participants and also to Dr. Jeroen and Dr. Astrid. Thank you. Okay, so Dr. Astrid, while do you still have some closing statement or closing remarks? Okay. So I think the participants, thank you very much again for your active participations. I think we've been having a great community for this past 4 weeks, discussing all important aspects on medical and health professions educations. And it seems that we've been trying our best to support each other. So all participants are allowed to leave the meeting. And I hope Dr. Jeroen and Dr. Astrid can stay for a while, because we would like to have some debriefing sessions and also, of course, feedback on the preparations and as well as the implementation. Thank you. Dr. Jeroen, I hope that you still have time.